The combined Med-Peds program is a true combination of internal medicine and pediatrics. And so at the end of the program, the graduates will be both internists and pediatricians, with all the culture that comes along with those specialties. Hurley is really, I think, an optimal environment for becoming a good generalist. Hurley in general has amazing population of patients. There's a million persons in what we call the primary catchment area, which means that really a million people in this area would see Hurley as the hospital to go to when they got sick. So we see sometimes disease processes that are more advanced than I wish that they were. And it provides, I think, an opportunity and a responsibility because we are the physicians for those patients, and so therefore we really have a responsibility to give the best care that we can. And from a medical education standpoint, you see some amazing things. I think the other thing is that this is a very practical place. And so really, people here are probably a bit less hierarchical and interested in really what does the patient need and what are we going to do for them, and who can do it, and not so much what level you're at, but how we can get to it in a way that's best for the patient. In addition to trying to provide the best education that we can in an inpatient setting, which is fairly traditional, we also in our program have our own clinic out in a site outside of the hospital. And this is in a federally qualified health center, so we have a lot of patients for which we really are the doctor. And they come sometimes because they don't have other places to go. And again, it's that responsibility / opportunity tension. In that clinic, it's fully staffed by Med-Peds. We take our own sick calls, we take our own after-hours calls within the program. And we have, during our senior years, the residents have 6 months total that they spend outside of there, in addition to their continuity clinics in that clinic. And so they really have the opportunity to make that practice their own. So it is the program's group practice, but it's also, I think, allows the residents who are motivated to really kind of take control of that practice while they're out there during those block months. Additionally, they have the opportunity to get much more familiar and I think grounded in how an ambulatory practice works in office practice. And this is important for generalists and subspecialists. I have residents that have gone out into so many different places that don't have any physicians, and really being able to build something that provides care where no care existed before, as well as some very good subspecialty fellowship programs as well. I have residents who are in management right now at Johns Hopkins, and so kind of the possibilities are pretty open, and I think the program provides a very good platform for that.